So at 7:04, call the meeting to order. Welcome, everybody. Welcome, board members. Thank you, Maureen, for joining us and for taking such good minutes over these last few months. Welcome. And I think our first order of business is our minutes. Have any, if it's review of the minutes from August 19th. Do I have any comments on them?
I thought they were fine.
Look good.
Hearing none, I'll take a motion.
Make a motion to accept the minutes.
Second them.
All in favor? Aye.
Aye.
Thank you very much. Okay. Are there any public comments at this point? Okay. So that moves us on to, Larry, you want to bring us, is Karen, are you here?
She was a moment ago.
I'm here.
Oh, there you are.
Okay.
Karen.
So,
Hi.
members, Karen came to me with an ongoing issue, and after discussion, she is asking for the board to convene a dangerous dog hearing. You have been provided with a memo to us, but I'd like Karen to explain and give you a little more detail about her request.
Hi. So I actually myself recommended or requested for a dog that has had 3 bites in the last year. And so we were gonna, I guess, go ahead with it tonight, but we wanted to give the dog owner a little more notice, an official notice. I think she knows it's coming. And I also need to get in touch with one more person who is the first incident involved a child, and I have yet to speak with his guardian, his grandmother, and I want to make sure they're aware and have the option to participate if they want to. So I guess we'll be doing it within the month, maybe.
We'll have a special meeting for it.
I guess so, Larry. I don't know. Maybe next Board of Health, or maybe separate. You guys think?
I am recommending to the board that we have a special meeting within the next couple of weeks to address this matter only.
I think
I'm
that,
open to that.
yeah,
That's what we've done in the past in general. Because often we get a number of people wanting to be heard, so that's fine.
Right, right.
So I will work out some details with you and poll the members on availability, and work with Karen to get all the notices out, and we will schedule it as soon as we can, as long as it does not conflict with council meeting.
Great. Thank you. Thank you, Karen.
Good.
Night.
You're welcome. I'll see you soon.
Thank you very much, Karen.
okay.
Bye.
Members, the next matter on the agenda is item 5, Oakley Country Club renewal of their tobacco sales permit. The country club did not renew their 2019 and 2020 permits. It is now, I believe we received the applications. I've given you all the background on it. And I'd like to invite Mr. Gupta to describe the summary he provided to you.
Thank you, Mr. Laird.
In addition to that, what I'd draw your attention to is when we sent out the 2019 renewal permit on 5/29/19, when the permit application was not received. A call was made and they spoke to someone named Sue about the renewals. So I invite Mr. Gupta.
Thank you, sir. Good evening, board members. So we did receive this application on July 20th. That included application for both 2019 and 2020. And 2 days later, I left a voicemail for Mr. Scott, and then we had a conversation same day. Mr. Scott mentioned that it was a lapse on their end, but some family hardship that he mentioned it to us, you know. And I have put that whole email in the notes for you. He was dealing with the daughter's illness. You know, she was suffering from cancer, and I'm sorry for that. But that was the hardship he mentioned in the email that I've provided to the board in our summary. After that, I've discussed this with Mr. Larry, and according to the regulation, we just have 30 days grace period after the permit is expired. So we are talking here like almost 18 months, you know, into 2019 and 2020, because we received it almost in July. And Mr. Scott is also available with us, you know, Mr. Scott Johnson from Oakley Country Club is on line 2. And I can provide any more information if the board needs.
I don't know if the members would like to hear from Mr. Johnson now.
Yes, that'd be very good. Thank you. Thank you, Mr. Johnson, for appearing.
Certainly. Ladies and gentlemen of the board, yes, I completely whiffed it. My daughter has gone through, she's undergoing chemotherapy for leukemia. It started in the fall of 2018, finally diagnosed in June. Spent 90 days in the hospital thereafter. I have missed the deadline. You were put in a pile. I didn't hear from Sue. I didn't get that information. That's on me. That's on my fault. I'm not trying to escape paying the fee or the fine. I understand I whiffed this. This is my error. I apologize to the board, the town of Watertown. I ask for leniency and know that going forward, ladies and gentlemen, I will not make that mistake again and make sure that you guys are at the top of my priority when it hits in November. I believe that's when it hits in November. One ask for the committee or Mr. Gupta, it could be addressed to me going forward. If I'm allowed to have it back, that it gets addressed to me versus the country club. Therefore, it ends up in my mailbox, not in the country club's mailbox.
And we'll certainly do that, sir, you know, in case.
I'm sure the board has questions for Mr. Johnson.
Sir, one question I have is, what
I'm
is the
somewhat-
extent that you are selling cigarettes, and who do you sell them to? And
We only sell cigars in the golf shop. I'm at the country club over here in Watertown. I sell it to members and some guests, and that's it. Anybody who's even close to being underage, not that we have any of those practically, gets carded. We haven't had an issue in years. My guess is.
where do folks smoke those?
What?
Where do they smoke those?
They smoke them on the golf course typically, or sometimes we have outside seating that they'll have cigars at.
Thank you. Do the other board members have any comments?
Well, I guess I'm somewhat concerned about equity, and I appreciate how difficult that this past year and a half and going forward it is for you. And yet, on the other hand, I'm concerned about equity with other vendors who did not submit on time. And are we treating people, I think we need to treat the various vendors equally. And in other cases, I think we probably would have not renewed the license under these circumstances.
Also concerned that the club doesn't have any backup for you. It sounds like you're just, Scott, you're totally, no one, with the people selling the cigars were not, didn't recognize that the license was out of date. It sounds like, it's not really, obviously your choice, you're a private club, but smoking in a health kind of oriented facility seems not to be the best of situations.
All the smoking takes place outdoors. There's nothing going on indoors. It's on the golf course. There's an area that sometimes they smoke at, but nothing goes on inside the club. And ma'am, to your point, Ms. Beck, you're right. I whiffed this. This falls on me. I made the mistake. I understand that you can pull the license and you have every right to do that. I hope you won't do that and punish my club for something that I did.
Well, you should also understand that we're at this, you're a sort of case point because we just changed regulations, 2 years ago, I guess, about, and that if people didn't renew their license, the license is renewed. Watertown has, I think it was the next to the highest town in the state in terms of the license per capita. And it was our intention with the change of the regulations 2 years ago to begin to try and decrease that, to make tobacco less accessible to the general public.
Mr. Chairman, through you, I have a question.
Yeah.
How necessary is the sale of tobacco to the operation of the golf course, Mr. Johnson?
It's a not a privilege, but it's
Convenience?
an accessory. There's I don't believe there's any business that smoking is essential in here, folks. It is a recreational thing when players typically play golf. Not all, I mean, I don't know how many I sell in a year, but I sell a number of them, and they use them for entertainment on the golf course.
Okay, so it is not, it's not necessary to the operation. I'm sorry, Mr. Donald.
Yeah, no, if I may, because your question is what I was thinking. This sounds like it's a convenience. The players certainly could bring cigars with them.
They could.
And if they know that they no longer can purchase them there, they probably will. And it's not an integral part of your business, so the impact would not be extreme if you did not renew this license. And again, I feel, as everybody has expressed, for your personal situation, but I don't see that this is that big of a part of the business and that it should be renewed.
All right.
If I may, Mr. Chairman, I really had angst over this. I understood Mr. Johnson's situation, and I feel for all that he went through and is going through with his daughter. The challenging thing is that this is a license. We have had discussions with former employees, and it seems that we have all had the situations where permits were not renewed on time. Further, to Dr. Beck's point, it would set precedent. So then we would have people who fail to renew for a year, for 2 years actually, come before you and claim hardship. And then there's an expectation that we issue that permit. My honest opinion is we should follow the guidelines that we set forth in our regulations. Unfortunately for Mr. Johnson and Oakley Country Club, that they did not renew because of extenuating circumstances. However, it is not necessary to the operation, and their members do have an opportunity to source their cigars at other places.
Thank you. Any other comments?
I'm good.
So I hear that it sounds like it is the feeling of the board that we should not renew this license, and I would take a motion to that effect.
Well, Mr. Chairman, before the motion is made, it is not a matter of renewing the license. It is reinstating a license that has expired for over 2 years, and pursuant to the regulations, that license became non-existent. It reduced the number of licenses that were issued in the town.
Right. So the question is whether, yes. Okay.
Whether
So-
you reinstate or not.
Is that is that enough of a motion for Maureen, or would you like to put that in a motion form and then we can?
Dr. Beck?
I make a motion that the board has decided to not reinstate the tobacco license for the Oakley Country Club.
Do I have a second? Yes, Richard shakes his head.
Mr. Arnold indicated that he
Yes,
has.
second.
All in favor?
Aye.
Mr. Johnson, we're really sorry that this has happened, but it is the way the regulation is, and it's, as the board feels, it's hard after all this time to go back against it.
Will there ever be an opportunity to reapply?
Well, the regulation says that if another vendor in town, I think we have 36 about at this point, if another vendor in town so chooses to give up their license, they can transfer it to you, I believe.
If I may, Mr. Chairman, just for clarification, the answer is no, because licenses are transferable on that same
Only at the
location,
same property.
only,
I'm sorry, you're right.
not to another location. So even if Mr. Johnson, if Oakley Country Club was selling its club and they had a license, then, and someone
That's right.
wanted to sell tobacco, then that license would be transferable to them, but he cannot purchase another license like liquor licenses and transfer
Right.
it to the club.
Thank you, Larry. I stand corrected. So, yeah. Okay. Thank you, sir.
Thank you for your time.
Okay. Face
Mr.
coverage.
Chairman, the next item is the face covering review of the board's order. I had asked town council to review quite some time ago. If I can give the board some historical perspective. On April 30th, we passed this order requiring face coverings throughout Watertown, both indoors and outdoors. Subsequent to that in early May, and that was because COVID-19 was spreading rapidly. Face coverings were seen as one of the key ways to reduce its spread, and there was no order throughout the Commonwealth. There were orders, I believe, in Somerville and a couple of other cities. Boston had not even enacted theirs as yet. Then the governor had issued an order. There were differences between the governor's order and ours. The governor's order allowed for the wearing of face coverings for individuals who are in open places but are unable only to maintain a distance of 6 feet or less. So if you were able to maintain the social distancing, you were not required to wear a face covering. Also, our requirement was that children 5 years and older should wear face coverings. The governor in his order included children 2 years and older, but children between the ages of 2 to 5 were not compelled to wear a face covering if they were unable to do so. Of course, there is the exception to the order where people who have some type of illness that is validated by their doctor are not required to wear a face covering. All we're doing is bringing this order in alignment with the governor's. All we're asking is to bring this alignment with the governor's order. Additionally, there are several changes and guidance that is being put forth by the Department of Environmental Affairs, and they are basing it on the governor's order. It can create an impediment, or it is conflict with what the recreation and other guidelines that are coming out, including guidance for schools, etc. So I urge the board tonight to amend its emergency face coverings as submitted to you.
Larry, I'd like to thank you for rephrasing that order so that it's not, and I hope the board notices, we're not just rescinding our order, which might imply that you don't need masks, but we're restating the governor's order so that it's very clear that we're in most situations requiring masks as is appropriate.
I think
It would
we
sound like if we were rescinding our old order, it would sound like wasn't important anymore. And I want to be
Right.
very clear that we still think it's very important.
Right.
I
And
think we can acknowledge. Go ahead, Barbara. I'm sorry.
I was just going to say that, and we're achieving pretty much the same degree of public health protection with I mean, it's not a requirement that you wear masks if you're going to be more than 6 feet apart. But I think public health will remain protected. And I think it's probably more enforceable or easier to obtain compliance.
And I also want to add, I think we can acknowledge that our initial regulation was beyond the governor's recommendations at that time, and this just brings us in line with those recommendations.
And actually, I've been, I was recently down on the river. I was amazed that more people than ever seem to be actually keeping the mask on even when they're running and hiking, which is great.
So let me, again, a scenario. Walking down Main Street or Watertown, our sidewalks are not that broad, and you are going to be passing other individuals within 6 feet. So I don't see any indication in this or previous about the time frame involved. You know, as we know for COVID, one of the major factors is the amount of time you spend within that 6 foot distance. And I don't know if we need to acknowledge that or address that it's also, it's not a violation if you're passing somebody on the sidewalk and you pass within 6 feet. Do we need to document that somehow?
I don't think we should. I think what we need to be consistent with the governor's order. And the more loopholes we create is the more we will get non-compliance.
And I think actually, if you're walking on a tight sidewalk, you should have a mask on. Okay, we need a motion to approve the statement as Larry has recommended.
Dr. Strauss,
Yeah.
before you go, in the audience tonight is Peter Santola, the Director of Recreation. He has a comment.
Sure, thank you, Peter. I'm sorry, I didn't see your hand there.
You're muted, Peter. Yep.
Yeah. Thank you, everybody. Pete Santola, Director of Recreation, and thank you, Larry, and the board for your leadership. I just want to kind of go on record quickly to thank you, obviously, and to understand how difficult this situation is. Number two, I just wanted to let you know that the Recreation Department took your order very, very seriously. And, matter of fact, we've gotten into some kind of heated disagreements with some. We basically were making sure that as much as possible, people in the parks, we didn't worry about anything else, but people in the parks, Victory Field track and so on and so forth. It's hard because you can't be everywhere, every place. So we did do that to the best of the ability. I think, I'm certainly very supportive of what you decide. But I just want to let you know, it was at some level, having it stricter was a little easier for us because either you had the mask on or you didn't. And then just moving forward, it's just a little difficult. So just kind of think a scenario on a track. We have walkers, we have runners. And so, most of the time people are spread out, but at some point they pass each other. So just wanted to make you aware of that. It's just, I think it's a good move, and I support the move to be in line with the governor. But I just want to know it will make us, and we take it seriously, a little difficult to kind of make sure everybody's doing it because we've already heard, oh, I'm 5 feet away, Pete, or I'm 8 feet away. Some people are being fresh, but just to give you an example that in a big field, we're following the guidelines from the state and so on and so forth, but it just makes it a little more difficult, but we certainly fully support whatever you decide. And thank you for the opportunity to talk tonight. Thank you.
Thank you, Peter. Well, it's nice to hear that the original decision we made your life easier because we thought that was the very reason we passed it that way, because we thought in situations like yours, it would be very hard to police. And but I think the politics of where the governor is just hard to go around. We where we are.
I'll be honest. Initially, I was, I thought it was too tough. But
yeah, you were extremely resistant.
I would, I don't know. I don't know if I use that term, but basically it was a little difficult. But once we got into it, I thought it was easier. But again, we're fully supported. You folks are the doctors. I've been asked many a times, Pete, are you a doctor? Are you a medical professional? And I say, of course not. So
well, the governor isn't either, so who knows?
But thank you very much. I don't want to take any more time. Thank you, Larry.
Peter,
thank you very much. Thank you.
Can I ask a question that's somewhat related, Peter?
Yes.
Organized sports for the town. How does this affect those practices? When you have teams or you have well, the sports better than I do.
Yeah, excellent point. I mean, basically, at the beginning, although Larry and I had some passionate discussions, basically our youth groups, baseball and softball are doing a very, very good job of that. And then we really limited the amount of people who received permits for us. And everybody who received permits, they really had to go through the ringer per se and identify the protocol and so on and so forth. The other thing that it's going to make it interesting and probably a little easier, I think, for Watertown High School, they have a couple of days ago, the school committee announced supported that fall session 1 sports will be is approved, and it would be cross country, soccer, field hockey, and golf. So, one of the questions was, and the athletic director is Ryan Murphy, he's done a great job. If they had a cross country meet at Arsenal, so the MIAA, which is the governing body of high school athletics, said that the cross country runner can remove the mask during the cross country meet. But then I had to tell Ryan, I said, well, at this point, the Board of Health requirement supersedes that. So I think this will make it a little easier and a little more flexible for such things as the high school athletics youth groups. In terms of my program, I'm not going to deviate. We had a very successful summer program. We made everybody wear the face coverings at all times, even from kindergarten up. And I was pretty surprised that everybody kind of did it for the most part. And so we're going to offer fall programs, and I'm still going to mandate that our participants have face coverings at all times. But I don't know if that answered your question or gave you an insight.
Yeah. I look at like the men's summer basketball league. Did that happen this year?
No, 2 reasons that didn't happen. Number one, I think the primary reason is the state guideline does not allow basketball competition. So you really technically can't play full court. You can't play 3-on-3. And then at the time that the league started, everybody was really concerned. That's really been the major problem in the town, is people just have been basically ignoring that guideline. So they've been playing full court without face covering. So ultimately, and I don't want to take up too much more time of your time, we removed the rims at Casey Park because I was down there kind of too often. And so that's what we did. So.
And they're playing every day at
Yeah.
Salt and Stone. Every single day.
Yeah.
No face coverings, and they're playing full court games, which shouldn't be happening.
So I think the enforcement piece has to be looked at. I'm certainly not going to, I called the police like 3 times just because I felt a little unsafe, myself. People were getting a little in my face, to be honest with you. But we're certainly not going to, it's going to be difficult to enforce, but we'll do the best we can and support what you decide.
One more quick question, Peter. Thank you. What about the courts over on Route 16 outside the square? Is that by the Phillips School? Is that what I'm thinking?
The Parker School.
Yeah.
Those are that was what I call the hotbed item. They wouldn't make it easy for themselves, and that's where I used to hang out for 2-3 hours at a time with my vehicle. I would say I needed to get a life, but they would come down 30 guys, and most of them were out of town, and they had no regard for any of the guidelines that we had. So that's the court that I took down the rims.
Oh, okay.
Thank you, Peter. It's really tough, but I really applaud you for maintaining that folks still have to wear masks if they're playing games, because they can't help but to be within 6 feet of each other. There's just no way.
Thank you.
Thank you. All right, we should need a motion. Rich, would you move a motion?
Yes. So what do we call this document exactly? Is this an update, an amendment?
Amendment to the emergency face covering order.
Okay, I make a motion that we accept the amendment to the emergency face covering order.
Second,
I second.
all in favor?
Aye.
Aye. Thank you. That's great. And thank you, Peter, for joining us tonight. I know.
Next item on the agenda, Mr. Chairman, is Watertown Biosafety Committee appointments. There were two recommendations. We have two positions to fill on the, two public positions, sorry, to fill on the Biosafety Committee, as well as you and I have seats on the committee, and they can be either in person or by designee. Dr. McManus, who is the consultant to the board for biosafety, has graciously done some work for us and came up with a short list of 4 people. And in reviewing their resumes, I would like to recommend to the board that we appoint Dr. Deborah L. McKeown as a public member and Miss Dr. Bradford Parsons. I have provided you with the resumes of the individuals. Dr. McKeown is here and Dr. McManus is here. I also have, I know the chairman may have a suggestion for Dr. McManus at during the discussion, but Mr. Chairman, through you, I'd love to invite Dr. McKeown to speak.
Thank you.
You're muted.
You're on mute. Thank you.
Oh, sorry, this is for me. Hello, thank you to the board. What information would you like to know? Would you like to know a little bit about my background? Are there specific questions?
I think a little bit, just a brief background and why you're interested in this position would be great.
Sure. So my background has been primarily research. I got my PhD in molecular biology and genetics, and then I did a postdoctoral fellowship at Mass General doing working with pathogens, and sort of I've also had an experience of trying to start a startup with just a few people and working in that environment. And now I am in a large FDA regulated biotechnology company. And so going through each of these, it's been very interesting dealing with the more practical side, right? Like dealing with NIH and various regulations and making sure that everything has been done properly and everybody has, stayed safe and the research could continue. And I think that making sure of that is very essential for any research to happen. And so I want to be able to contribute, any background or knowledge or experience that I have from that to be able to help people research continue in a way that's safe for the town that, I live in and the town that I'm raising my children in. So that's sort of the background of why I am interested in this position, is I want a way that I can give back to Watertown in an area that, I have some knowledge in.
Okay. Sounds wonderful. Barbara, Rich, any questions for Deb?
Mine is pretty simple. Do you have any conflicts of interest in serving in this role with any current labs or possible future labs that might exist in Watertown?
So the company that I work for now is in Cambridge and in Seaport and will not be in Watertown. I don't have any involvement with any of the companies that are currently in Watertown or
Thank you.
that I could imagine being in Watertown.
Thank you.
Thank you very much, Dr. McEwen. And I just have a question as to the nature of your work that you're doing now. Is it all on the research side, or is there regulatory and management responsibilities as well?
Yeah, so I have About 2 years ago, I moved away from just from doing primarily bench work, and now I am involved in translational oncology. So it is working in the regulated space and getting sort of the approvals necessary for, we're a diagnostics company, so going through the approvals that are necessary. While I'm not in the regulatory group that does the actual approvals, I do help consult with them and answer questions from the science side and making sure that we are compliant with the requirements for the area that I'm involved in. I'm involved in that process. Of course, it is a large group of people who are doing it.
I mean, I think that's very helpful because you've got both sides of the equations, the basic science, as well as the understanding the compliance in the regulatory sphere.
Thank you.
Mr. Chairman, if I may, Dr. McManus is here with us, and I don't know if you'd like to invite her to make some comments.
Oh, I will in a minute, but I have one more question that I was about to ask. Is there, have you looked at our regulations, and do you have any comment about how you see their ability to be implemented?
So I did read through the recombinant DNA ruling, and I would like to know more sort of about what is involved beyond just writing up this document. I am not sure how that is normally implemented, or what you receive from the different companies that you evaluate. So I do have a lot of questions.
Yeah, so that's good, because I think, as Heather will say, we still have, it's a still work in a process, and we have lots of details that we have an application that has to be finalized, and there'll be plenty of time to work on that kind of, that's exactly what we need this board to be doing. Heather?
Yeah, so there are definitely, it is a new regulation, and there are various aspects that I think in the initial first couple months that the biosafety committee could sort of fine tune some of that. And I have sort of in working with Larry ahead of time, you know, there are now a frequently asked question about the regulation that should address some of those questions. But in preparing that, I was able to talk to Caroline Slater. I might be misremembering her last name, but she works with Safety Partners, and she works with a lot of the companies in Watertown, and that was very helpful to get sort of her comments as to like where her questions were, where the company's questions were. And I think there is a little bit of fine tuning to do in terms of the definitions a little bit, and in terms of just making it crystal clear which companies sort of fall under certain exemptions. So I don't know if there's any other questions or.
That sounds very, very promising to me. I was very impressed with your CV, and thank you for coming tonight, presenting. And do you have one other applicant that you want to present?
Mr. Parsons is not here with us tonight, but looking at his resume, which I presented to you, he is extremely versed in the licensing, and not only the licensing, but also the safety aspect side of lab operation, which we do need someone with those specific skills to sit on the WBC. So, you know, we have two really great candidates. Dr. McEwen brings the operational side and the review side, while Dr. Parsons brings that safety side into it. So I think that is really, really good for us if the board approves of, appoints them to sit on the
Larry,
biosafety.
just as a minor point, Mr. Parsons is not a doctor, is that correct?
Oh, he is a doctor.
Yes, a
Oh,
PhD.
okay. I'm not, I think
He's a
my
PhD.
screen, okay, my screen cut off at his education, it looks like. Okay, thank you.
So Larry, do we need to, is this something that has to go through a motion of the board?
Yes.
Yes. So if there are no other questions, I would ask the board to present a motion.
Barbara?
What is Brad's last name again?
Parsons.
Parsons.
I make a motion to appoint Brad Parsons to the Biosafety Committee for the town of Watertown.
Second,
Second.
all in favor?
Aye.
Aye.
Thank you.
And then I make a second motion to appoint Dr. McEwen to the Biosafety Committee for the town of Watertown.
Second, all in
Second.
favor?
Aye.
Aye.
Great, thank you.
Thank
I
you.
have one more ask for the board on this. There is a designee who, from the fire department, who would automatically become a member of the board upon confirmation of that nominee by the town manager. I'm waiting on that confirmation from him at the moment. So just wanted you to know that, as well as Dr. Strauss and members. As you're aware, we were funded small funding, but we were funded to have a consultant, and I've asked Dr. McManus if she would be willing to serve in that capacity and advise the health department and the Board of Health, and she graciously agreed to. I know the information and advice she provides us and what she's going to be paid is way different. It's like trying to feed someone with a rice grain when they really need a pound of rice to eat. But we're happy, and Mr. Chairman, if I may suggest, because it will not create a conflict, if you wish, you may nominate without having to have confirmation by the board, Dr. McManus or someone else to represent you on the Biosafety
Right.
Committee.
And I would very much appreciate, Heather, if you'd be willing to do that. Larry and I have talked, and we understand it will not be a conflict for you to be consultant at the same time you're the chair, since you're working for the town.
That's great, and I'd love to do that. And I think we have a really good starting place. A lot of things sort of gathered together to kind of get things going as soon as we
That's
can.
great. And we'll welcome you back to the board anytime, any month you want to give us a heads up on your progress. And
Okay.
If you need, obviously, as my designee, if you need to come back to the board and raise any questions, we're very happy to entertain that.
Great.
Thank you very much. Congratulations, Dr. McEwen. I am going to draft your letter of appointment and get it out into the mail for you before the end of the week, but your appointment is effective now.
Wonderful. Thank you, everyone. I look
Thank
forward
you.
to working
Welcome.
with you.
Thank you for joining us.
Staffing and department updates. I'm glad to see that my Assistant Director, Chief Environmental Health Officer is still here with us. As you're aware, we have had one new staff member join us recently, Emily Leflem. She has had some experience in housing. She is going through her training right now with Raj. She is getting out into the field, and just like him to give an update on what is happening with the two inspectors with their training right now.
So, sir, definitely with COVID, we are not able to touch as much as we should have, but mainly housing nuisance complaints we are addressing. Limited stuff in restaurants still, but as I mentioned in the email earlier, during the whole COVID process, we have visited around 10 restaurants, a couple of pre-openings. We are going to one tomorrow. So trying our best to get them trained and get them in the field. But again, with COVID, little less in the restaurant side, more housing nuisance complaints, or COVID complaints that we are getting. Face coverings, a lot of those coming through our way. And both
fined? I'm sorry. Has anyone been fined in town for the face coverings?
Mr. Larry, or I can answer that. So yes,
Yes.
Yes,
Main Street Mobile was issued a ticket for $300 last week. And after several complaints from them, they have also been referred to the Division of Labor Standards for action, because despite the fines and everything else, they still choose to ignore the
I'm
face
sorry, I didn't hear who it was.
Main Street Mobile. Last week we had a member of the public come in who had gone in there, and she had her car sticker being done, and they were all over her car getting things done. When she mentioned, why aren't you wearing a face covering? They were rude and dismissive of her. And she left and she came up to us and complained. There was another person who had gone in there. And Raj has put together a summary on this whole thing. If you wish, I can send it to you.
And we have total of 4 complaints, at least 4 that we have documented in our system that we had against them so far. And this non-compliance was going on, with us issuing verbal warnings, written warnings. So there are a total of 4 complaints we have in our system against Main Street Mobile.
Have they paid their fine?
They were fined last week. They have
Okay.
21 days, but they have since been to town hall to complain about the fine and our bedside manner when we went there. This is a place where I had gone with Raj, and one of the manager was there sitting with his face covering. I said, why are you not wearing a face? You have 2 signs up that says anyone in here must wear a face covering, yet you as the leader of this establishment, you're choosing not to wear any. When you looked in the workday, 2 guys standing up within a foot of each other having a conversation, no face covering.
Yeah, I'm thinking also if you got, people in general don't like to complain. So if you got 4 complaints, there's probably a good number of people who would have liked to complain, but people generally are embarrassed complaining, especially going to town hall to complain. So I do think that the 4 complaints alone say something.
Yeah, one person, she had gone in there to get her sticker done, and when she saw they weren't wearing face covering, and she said, aren't you guys supposed to be wearing face coverings? The response by the owner was, do you want your sticker done? Well, she left and she complained to us.
So Larry, what happens now you've imposed a fine? What happens if you return for a follow-up and they still do not wear a mask? Do the fines expand, or what goes on then?
Oh, we have been keeping an eye on them, and they have chosen not to comply. So what we have done, the Department of Labor Standards has specific jurisdiction over the gas station, and we have referred the complaints to them for action.
So our fine has no real teeth behind it?
It has teeth. We can keep fining them $300 every day, but if they're choosing not to comply, then Labor Standards has to make a choice whether or not they would ask them to close or some other action.
Okay.
It's not as if it was a food establishment, and we're starting to see, we saw recently a number of establishments having their doors open. It appeared that there could have been some confusion with the way Labor Standards had written their guidance, and the CDC had issued guidance saying that you should increase your ventilation as far as possible for open doors and windows, etc. But the food code was very specific in that you cannot have any of your outer openings open without specific permission from the Board of Health. And that is done under variance. I don't know if you remember, but earlier, late last year, CityWorks had come into us asking for variance to have their windows and doors open, and they would install air curtains at their kitchens, which they did. There's one place that we've had to speak to on many occasions, and some others as well. We've had issues with people complaining about a couple of the restaurants, and notably two in East Watertown, where people behind the line standing up right next to each other, preparing food, wearing face coverings. The owner of the establishment was not wearing a face covering, people choosing to have the face covering on as a fashion accessory and not as a practical guide. So it was pulled down over the nose, on the chin, and we've issued tickets for that at a food establishment. In fact, 2 food establishments got tickets for those.
Sir, I would like to correct. So it was actually 3, so far 3 food establishments, yes.
Thank you.
Absolutely.
So they're kind of, they're in a rock and a hard place as far as they're trying to do the right thing by opening their door. Is it possible that they're just not aware of the town requirement that the door be closed?
This is not a town requirement, Mr. Arnold. This is a requirement of their operation as a food establishment.
Right.
And it is a fairly established requirement. These businesses were in operation prior to 1991 when these rules came into effect. So they're 19 years later, they are aware that they should not be doing that. There's some who choose at times to do that, and we have to address it. We've also sent out an email to all the establishments, telling them, that, we understand that there may be some confusion, and we weren't fining people. We were telling them that you need to keep your doors closed. Yes, inspectors were going out and telling them, giving them warnings, but it persists. And when it does persist, there's one establishment 4 times they were told before they got a ticket.
Yeah. So you gave them plenty of opportunities to comply.
And that included an email that was drafted by Raj and reviewed by myself and sent out to all the food establishments.
So regarding food establishments, are we doing routine inspections?
At the moment, no.
How long has it been?
9 months.
And do you think that it's unsafe for the inspectors? Is that why we're not doing them?
That is correct.
But that
We
does
are
make
going
me
to-
worry.
We are going to, well, you know, we have been paying some attention and doing spot checks at places of concern. So it's not as if they're not being looked at. We're not doing comprehensive food inspections.
Yeah, I guess it's just, I think Richard, you're getting at is if we have an eyeballed, obviously they don't have very many people inside to worry about their seating area, but it's the kitchen. And if we have an eyeballed, are they keeping it clean once in a while? Is that a
Yeah,
risk?
and we are looking at those things. And remember, restaurants were not allowed to reopen until July. So between May and July, they were closed.
Or they could do takeout, right? So the kitchen,
Yeah.
kitchen was open.
Yeah, is that, and again, you probably considered this, but if it's mostly person-to-person airborne contact we're worried about, is it feasible to just ask that the inspector go through the kitchen unaccompanied and conduct their inspection that way?
It's something we can definitely look at.
And sir, I just want to, I'm sorry, I just want to add, like, to Mr. Larry's comment, we've been to at least 20 establishments throughout the COVID, you know. I mean, we have done some inspections where we are worried, or if they was closed, they want to try to reopen. So we've been to almost 20 of those establishments and done 10 re-inspections also. So we've been to like 30 inspections so far during this COVID time, you know. So I just want to add to that.
Yeah. I mean, I know you guys have been really busy, so I don't think, but I think this isn't going to go away quickly. So we do have to,
Right.
at some point, what, at least some kind of annual inspection. It won't be the comprehensive that we might have done, but something to lay eyeballs on the inside of some of these kitchens.
Right, and maybe prioritize the ones based on size or some other metric for risk potential.
Yeah, we will discuss it and come up with something and implement that.
Unfortunately, COVID doesn't keep foodborne pathogens from doing their thing. So,
It doesn't keep anything at bay because it just gets worse. We've already, the other update, I have sent it out to you. We have had 2 positive cases of West Nile virus in town. One is male in his 40s, and I forget the gender. I believe it's a male in his 80s. There's no value to doing any spraying or anything of that sort because one is totally unaware as to where the person contracted the West Nile virus. We have done all the larviciding we have, and as you all can feel now, our evenings are getting a lot cooler. And once we have temperatures below 50 degrees, mosquito activity becomes severely limited. However, we are not going to be out of mosquito season until we've had 2 consecutive evenings below 32 degrees.
2 consecutive evenings at what temperature?
32.
Oh, that's going to be for a
We
while.
have to have a hard frost.
Yeah.
Right.
So mosquito activity really wanes at this time of the year. And as we move into October and we get a lot more cooler nights, it's going to become better for us.
plus people aren't out as much.
Yeah, I think we're beyond the worst of it now. So I think we're probably at the end of, we've passed the end of the trapping season. So they're not doing any traps or monitoring. And our risk of triple E is very minimal. At this time of the year, we have passed the peak or the period when we normally see activity for mosquitoes that transmit triple E.
That's great.
I have no matters to present to you that was not anticipated before the meeting. Nothing came in today that you needed to hear. I will meet with Karen and we will come up with a date and reach out to you and give you a couple of dates to see what would work. Of course, I have to check the calendar to see what is available in the meeting dockets.
And
Well, you don't have to worry about space.
Yes. Well, we do have to worry about space. We have to worry about electronic space.
And I'm glad we're going to be doing that soon because 4 bites is a lot. And we
Mhm.
wouldn't want to have something, another bite or something more serious happen.
Yeah, I'm anticipating getting this to you by early next week with a date to schedule and maybe having it the following week.
Susan,
Another quick question. When does the farmers market end, and will we have somebody visit us to give us like a report on how it went this year?
I can ask Stephanie. That date eludes me right now. Once the farmers market was up and running, I wasn't really paying attention to it because the farmers market, while the employee who manages the farmers market is a health department employee, but it is not a function of the health department, it's a function of the planning department.
I think it goes close to Thanksgiving. They have a fall season as well.
Yeah. In fact, right now, all the products are coming in. I think it either goes to Thanksgiving or Columbus. I can't remember which one.
Yeah.
thinking about Stephanie, we had a very good Sunday afternoon. There was a very good substance use anti-stigma program.
Yes.
And Larry, do you know how many people actually listened in?
They had 55 plus. And I would ask Stephanie to also give you all an update at the next meeting.
We're still staying, our COVID numbers are still, active cases still staying very low, right?
Yes, they are. The challenge we're facing now is we've had a positive at daycare, early learning center. And
Staff or a child?
well, both, because the parent was a staff member and the child tested positive. So the parent became a contact, and we've addressed that. We've had one high schooler test positive for COVID as well.
In a high school, they're doing in-person classes at this point?
No, they're going to be doing remote learning. So hopefully no
So
one
there
is
was
able.
so there was no classroom concerns about contacts then?
No, the person was a hockey player.
Okay.
Yeah, I think sports.
Yeah, that is probably the big challenge we have with our youth in getting COVID right now. We are fortunate. Even when the individual tested, the individual was not at practice during his infective period.
And are they wearing masks when they play hockey?
Yes, they are to a large degree. Sometimes they do, sometimes they don't. It all depends on what the guideline is from Energy and Environmental Affairs. There's a guideline for just about everything, every sport from them.
Still tough. It's tough to be active, and if you're infectious, it's hard to stay uninfectious.
It is
Kind of
difficult.
an activity, I would think.
Right, so
Yeah.
that would be it for me.
Everybody, anything else? Can we adjourn? Maureen, thank you for your minutes.
Thank you, Marie.
Yep. And our next meeting is October 21st, is that right?
Whatever the third Wednesday is in a month.
Okay, so that's the 21st.
Okay.
Okay, thank you very much.
Thank you, everybody.
Being adjourned. Everyone stay safe. Thank you.
Thank you, John.
Night.
Good
And
evening,
thank you
board.
for,
Thank you.
It's really exciting that we all got the biosafety.
The committee
Awesome.
together, yes. And I am excited about the two members we've appointed. Their background is so fantastic.
Yeah,
The skills that they're going to bring during the review process is,
we're a very lucky community.
Yeah.
yes, we are. We are blessed.
Yeah.
Thank you. Good night.
Thank you.
Okay.
Good
Good
night.
night, board. Thank you, Mr. Larry. Good night.
Good night.
Maureen, good night.